Hello, my name is Rusty Owen Frank. I'm a member of the International Society for Environmentally Acquired Illnesses, also known as ICI. I'd like to share with you a template that I've put together. It's actually really a system for gathering patient information. It's quite efficient. It gathers a great deal of information, and best of all, the patient really does most of the work. So the information gathered will be presented to the patient in a form, and the output of that form will go to a spreadsheet, which can then be manipulated. Formulas have been added in, formatting has been added in. I'll explain all of this as we go along with this little introductory video. The first thing I'd like to do is put in a shameless plug for Google Suite. It's a system put together by Google. It costs a whopping $6 per member per month. I use it in my practice, have been using it since I opened the practice. And everything that I've created here and I'm willing to give away for free, which is an investment of thousands of hours of my time and well over $1,000 in consulting fees. I'm giving this to anybody that wants to use it with the hope that ICI will then be able to gather all of this granular data, combine it into an interrelational database so that we can use it to get really good retrospective studies of our patients and find out more information about this disease, sort of building the airplane as we fly it, so to speak. So without further ado, let's get into this. First off, you have to go to Google Suite. You can just Google that and you sign up for it. Once you're signed up for it, you can then make copies of these things, and I'll show you how to put them all together. It's really not very difficult at all. I don't have any specific computer training. I was able to create all of this myself, and I think I can talk you through it pretty simply. There are several different forms that the patient fills out. Let me just show you my website so that you'll get a better idea of how I have designed and created things. This is my website, and as you scroll down, you'll see the first button, tell us about yourself. The patient, there of course are instructions on the website too, but the patient just pushes that button and it brings up this form. Now what's neat about this form, not only does it collect all this data from the patient, but I've also inserted into it all of the privacy information, HIPAA information, consent for controlled substances, everything that could be needed for my patients to complete. So they've had a chance to see it, complete it before they even get to the office for their initial appointment. We then have them sign a document when they get to the office, but you can set it up so that it's signed electronically online, and it's 100% HIPAA compliant. You don't have anything to worry about in terms of the legalities and that sort of thing. As the patient scrolls down a little bit further, you'll notice that I've got different types of patient intake forms that I use. One is for controlled medications. I do addiction medicine as well. SIRS, of course, and then combined SIRS and controlled medications. A lot of my addiction patients came about their addictions quite honestly. They've got a family history of it. They inherited the gene, just as they inherited, in some cases, the gene for SIRS, which probably hits 25% or greater of the population. Yeah, I tell these folks, gee, the thing is, you should have picked better parents. You know, that's why you're here. But a lot of the addiction patients got addicted because they had pain issues. And, once we get treating their addiction, I give them the option to look into, could they possibly have this chronic inflammation going on? And if they do, I treat them for that as well. And then as we get the inflammation better, their pain levels decrease, and we have a much better success rate in getting them off of their controlled substances. So that's just been my experience. Anyway, the SIRS information starts here, and so as you can see over here, it's a 14-page document. It takes about an hour to fill out. It's extremely detailed. But again, gathering all this granular data is really what I want to do as much as we can. I organize the Google folder, into subfolders. for my addiction and SIRS patients. You can set it up any way you want to. I've called this patient charts, my AW for Appalachian Wellness, the name of my practice, patient charts. Pretty logical. As I see each patient, I create a folder for them. Everything that happens with that patient, any correspondence that comes in, labs come in, anything that happens gets scanned into their chart. I've chosen a nomenclature system for patient files where I put in year, month, day, last name, first name for the files. So, for instance, lab work that was drawn today, it's November 9th, would come in as 20191109, patient's last name, patient's first name. I also find it very handy. You can share these individual folders, the Google folder, with the patient. So I will create a folder for each patient by last name, first name. I will share it with them so that they have access to view the folder. As you share, you basically click on the patient's name, you click share, and anyone with the link can view. And over here, this means edit, so you just change it to view only, put the patient's email address in, send it to them, and voila, you're done. You can also get a shareable link right here. Just email them the link if you prefer. So it's a nice way of doing things. The patient has easy access to their records. They don't have to contact me when they want to go have a copy of their records sent wherever. They could just do that themselves. Let's talk for a moment about spreadsheets, because probably y'all are not too familiar with it. I certainly wasn't when I started fooling around with this. Everything I've done has been self-taught. There are basically three spreadsheets that we're going to go over today. The first one, the new patient ID form. These are just the demographic information. Okay, these are the responses that the patient filled out from the Tell Us About Yourself button that I have embedded on my home page. Then the next one is the SIRS initial visit responses. Okay, it's important to understand too that these forms, when they're filled out, they present all the information in a horizontal format along the rows, and I'll show you how to fix that as well. Next is for the SIRS follow-up visits, and then there's this template that we use, and this is the master copy of the template. What will happen with this, the first step you'll go through when you're getting ready to see a patient is you'll make a copy of the template, and I'm going to call this test patient. So what I will do is patient test. So that would be last name, first name, and I'll put a space in there. And I'm just going to leave it right here in the Forms and Sheets folder that I've put online with all the membership of ICI so they can share this. It takes a few moments for this folder to create itself. And while it's doing that, let's come back over here for a moment. The demographic information comes across in a row, as I mentioned earlier. You can select any number of cells and call this a range. You'll notice columns, vertical columns, are labeled alphabetically, and horizontal rows are labeled numerically. You can select the entire row or column by clicking on the little gray area here or here. And there's a function called transpose that we'll get into in just a minute that converts the horizontal to the vertical. Just like with Microsoft Excel across the top, you've got a bunch of different menu items on different things that you can do. And it's fairly self-explanatory. You don't have to delve too deeply into this to just simply use these formulas and templates the way I've set them up. But I do want to just make you be aware of the fact that they're here and how they work. Macros are something else that I've created. Macros basically simplify steps, things that you would ordinarily do routinely, monotony by hand, can be done automatically by the machine. And basically, I'm kind of lazy. I'd rather let the machine do as much of the work as possible. So let's go back over here for a moment. And there is the test patient information we've all put together. So the first step we'll do is we will take this information, the demographics in the horizontal format. I'm going to copy, and Control C is a copy function. Control X is for cut, Control V is for paste. So look what happens to this row. If you look carefully, you'll see that there's like a little dotted line here. And that's what a spreadsheet does to let you know that there's something that you can do with this information now. So we're going to copy this. We're going to move it over to column B here. We can't really paste it, but what we do is we come down to paste special and then paste transposed. Earlier I had mentioned too that I have a lot of the information that the patient says, here's my omnibus thing, additional information, controlled substances contract. I do acupuncture for addiction, so I've got a consent for that thrown in. Virtual visit fee schedule. I have reviewed all the information. Then the patient types this in to acknowledge that they have done so. Now, once we have the patient demographic material in a vertical format, it's very simple to come over here, select it by clicking on V, copy, and now let's go over to test patient, and that we created, by the way, and just paste. Now, as you do that, you see that not only is all this data here, but as we look at some of these other things, it's also automatically populated all of this information as well. I find that to be very, very handy. And we're going to get into some of these other things here in just a few minutes. The next one we'll do is the SIRS 1, or SIRS initial visit, clinical information. So again, we come over here, copy, bring it over here. Now, before we paste, it's important to understand that the rightmost column is going to always be a column that's going to contain formulas and other formatting. You can see here some of the formulas right here. Some of the formulas will be invisible. You won't be able to actually see them. So we're going to copy this. We're then going to insert one to the left, and then we're going to paste. And as we do that, you see that all the information is now available here. So we'll go back to this, copy this patient entered information from their form, go to column B, and transpose. Now, as we did that, some interesting things have happened. And I just want to take a few minutes and review this with you. With the spreadsheets, everywhere you see a little black triangle in the upper right-hand corner of the cell, you'll see that there's a little information that pops up. Okay, so it's really kind of interesting when you look at that, especially the SIRS Health Index, and I also put in the mast cell activation information. So these basically are how activities of daily living are related to anxiety, pain, depression, and mood. Here are the clusters defined by Dr. Shoemaker, who originally came up with this whole idea. The number of symptom days that they have the clusters. This is a healthcare index that I created. 100% on this would be perfect health. So the lower this number is, the more severely they are afflicted. I did the same thing with mast cell activation symptoms. This yellow area right here has to do with symptoms that are common to both mast cell activation and SIRS. Here, this little range is the anxiety in ADL filled out by the patient, pain in ADL filled out by the patient, mood in ADL filled out by the patient. ADL, of course, is activities of daily living. You'll notice there are different colors here. All these different colors reflect the different clusters as defined by Dr. Shoemaker when he first came up with this schema. Next are all the mast cell activation symptom questions. Then we come down to the SIRS initial visit questions. And if you want to expand any column, you can just come up here to the top. You'll see how you've got the double arrows and just slide it over here so that you can see everything that's going on. Um, there's a very, very lengthy medical history review of systems that goes on. And I'm not going to go over everything right now, but you'll get the idea as you go through it. Place where you can record surgical history, social history, family history. I've also got embedded formulas for height in inches, which will convert it to meters. It says centimeters, but that's incorrect. Weight in pounds will convert to weight in kilograms. And then it will also automatically calculate the body mass index, body surface area, and resting metabolic rate. Below that, I've got an area where you can enter all the patient's different medications. Uh, this is kind of a tedious part of the process, but again, I think it's pretty important that we collect all this data, and it does not have to be entered by the clinician. Any medical staff member can enter this information. Now, the next bit of information is we take this from the SIRS initial visit. Again, we copy and we bring it over to test patients chart. We highlight the column and we can hit Control V or paste. And there we have it. There's all their information. It's all formatted. Now, one of the other things that I like to do with this is, remember, column C is where we'll have hidden formulas and formatting, which seems to have disappeared here for some reason. And I will fix that. But basically what we do next is, excuse me, for their initial visit, we've already got a column B for the follow-up. What I do is I routinely gather all this information from the bottom of the mast cell activation stuff right up to the top, copy, and then I will paste it in here. And the reason for that is this way you can paste this into your note and you can have a nice, easy way of tracking and trending what's going on with the patient. My preference, bias, call it what you want. Horizontal alignment, I like to keep my text stuff aligned to the left and to the top, and this is how you can do that. So this gives us pretty much a good sense of what's going on with Mr. Test Patient or Miss Patient Test, whatever you'd like to call them. Coming over here to the next visit, this will be the SIRS follow-up information. And once again, what we'll do is we'll copy, come over here, transpose, and I'm not sure why these numbers don't come across, but they're not. So this is something that we'll have to correct on the template. And I will get that done so it will be a working, functioning system by the time you're ready to use it. I see here that we're off by one cell. So what happened here is we've got a slight there. That fixed that. And now as you look all the way down, you'll see that everything is lined up the way it should be. The allergies should be listed in the white. The medication update should be listed in the white. And basically what we will do with this information now is we can very easily insert another column to the left. And as time goes on, we can pull everything together. I like also just to keep it looking nice. You can select copy and then take these two columns and you can go over here to paste special and just put the format. And what happens now is you'll see that all the numbers have the same coloring bands going across for the different items. And height in inches, you'll enter this. It'll convert over to meters. Weight in pounds will convert over. And basically, we just take this information here, and you'll see there's a little box here in the lower right-hand corner. If you grab that box and you drag it over, it'll bring all your formulas over. If you put somebody's height in for the first time, for instance, 74 inches, it converts automatically, and you can drag this over for as long as you want to, for as many visits that you want to. You can put their weight in pounds, and this converts it to kilograms, calculates out your body mass index, your BSA, and the resting metabolic rate. There's a flaw in this we'll have to fix, but basically all this information is just automatically put into place, and then the next time you see the patient, you can track and trend what's their height doing, what's their weight doing, what's their BMI, BSA, whatever other values and parameters you want to look at. You also have an opportunity to list all of their different medications, and all this information is granular, which means it's all listed as individual things. Most of it is done by the patient. So it's really quick, it's very convenient, it's very easy to put all this information together. And let's see if this doesn't come across. Perfect. So there you have all the information for this visit. All the calculations have been done. You've got your anxiety, ADLs, pain, ADLs, mood, ADLs, cluster count, health index score for SIRS and for mast cell activation syndrome. And remember, this is all going to be available for the patient at any point in their time. Okay, so this is currently in the SIRS follow-up visit responses. So we'll take this information and make sure that it's in the patient's chart as well. So to create another column, you would simply come up here, insert one left, and go back to the SIRS follow-up visit, copy, and bring it over here and paste. So this way you can track and trend what's going on. And again, I like to keep them organized, left top formatted, and you can track somebody's progress as they're moving along. So I find this to be really quite helpful. And you've got their biostatistics. Right here is where the calculator is for the resting metabolic rate. And apparently there's a flaw in that formula, so we'll have to address that as well. And this is supposed to put the patient's age in. And for whatever reason, it's not doing that. So there are a few little flaws in this thing, but we'll get those corrected as they're on the site. This right here is a link to the SIRS overview outline, and that'll be in every patient's chart. This is what I used to pass Dr. Shoemaker's exam, which was a real doozy. So we'll see if we can, yeah. And then over here we've got the SIRS pearls. So to get on the outline, you just come up here and click on it, and the outline is only 102 pages long. To go back to the pearls, these are just notes that I've been putting together on different topics. I'm trying to organize them alphabetically. So basically, I'm just sharing some of my information for anybody who's interested in looking at it. Stuff that I find to be helpful. And it's all pretty well organized in hyperlinks and everything else. Excuse me, I don't know why these are popping up. So let's review some of the other tabs I have across the bottom and what they are, what they do, how they work. The first one, LabCore, is pretty straightforward. Again, I've got a lot of cells that have the little triangles so you can get more information. All right, this is a SIRS lab differential that I've put together. Sometimes you'll get notifications from the lab that you've ordered unnecessary lab work. You don't have the right diagnoses for the different labs that you've ordered. If that happens, you can just grab this information, copy it, paste it in a letter to the lab for the patient. And once I do that, I don't have any further problems. This is information, just little tricks on how to figure out the Rosetta Stone that Dr. Shoemaker put together. Here are the diagnostic criteria for SIRS as far as the lab values are concerned. We've put the patient's age in here automatically. Again, what I want to just kind of review for you is the most important thing to remember is this rightmost column will always contain formulas and formatting. You can get a little hint of it right here. But as we go down here, you'll see little things that'll pop up. For instance, in here, there's a big long formula that lets you know where the patient is at in terms of their ADH and osmolality. And their values are abnormal values, or usually what we see is a picture compatible with diabetes insipidus. Sometimes we can see a picture of SIADH, which is very rare. If that happens, you got a real problem. Below that, Cushing's disease versus Addison syndrome. A lot of folks with SIRS will start off with cortisol excess. And as time goes by and the adrenals burn out, they end up with a cortisol deficiency. So there's all sorts of information. Again, the triangles here, if you hover over them, will give you a lot more information about what's going on and what to do about it. A lot of time went into this, I can assure you. And I think as you start to use these and play with them, you'll have a better appreciation. Now, one of the things that I've put in here, and they work for most but not all, if we come down to macros, you'll see there's a big long list of different macros that I've put together. So if we come down to LabCorp new column and click on it, what happens the first time you run these things, you'll get this little error message or this little message up here that it's trying to figure out what to do and it needs permission to do it. So I just want to show you when this comes up. Basically, you just have to wait for a few moments, then you'll get this authorization required button that comes up. You click on it and it'll want you to put your Google account information and then give it permission to run. And then once you do that, the script will go ahead and run. And now we've got all the information. And again, the right-handmost column is going to be left empty of patient data at all times. And what you can do is you can just simply, if the macro doesn't work properly, you'll want to copy. And then when you're ready to insert new information, you will simply insert left. And then you will come up here and just paste. And once you do that, you'll start entering the information. Up here on the very top line is where I put the patient date information for when the labs were drawn. And certainly for cortisol levels and whatnot, you have to put AM or PM because you see here it's going to be different, AM or PM. As we come down this list, you'll see that the green bands represent areas that are diagnostic criteria for SIRS. I've also included some stuff that has to do with the Bredesen protocol, okay? And the formulas have things inside of them that will calculate out certain values, okay? Apparently it did come across over here. This you just basically run down the list. You'll see there's a lot of information that we can record very quickly. I wish the labs would give it to us in a table format where we could just copy and paste a whole column. Unfortunately, right now it all has to be entered manually. Maybe at some point in the future that will change. But you can get an idea of all the different things that we have here. Here's some mast cell activation syndrome stuff. Just a large variety of different things here that you can enter in. Where you see these little down arrows, if you click, you can just put in a negative, positive, whatever the values are. Something else I'd like to just kind of show you all as well is the concept of conditional formatting. And you don't have to worry about this, but basically, if you just look at some of these things, you'll see that normal values will come in green. Things that are a little bit abnormal, a little bit too high, a little bit too low will come in as orange. And then the values that are really out of whack will come in as red. So all this stuff has been put in into these formulas. So as you're entering numbers, don't be surprised if you see things start to change color and jump out at you, that sort of thing. For the Quest, same thing. We have a macro. We'll come down and run it. If the macro does not run, basically all you would do is collect the information. Take the farthest to the right column, hit copy, come over here to the column that has information, insert one left, and then just come up here and paste, and that'll paste all the basic information into it, and you can go ahead and enter values. Visual contrast sensitivity. I try to simplify these things as much as I can. You'll notice there's a pink band that goes across. Anything on or below the pink band, and we start off with left eye, column A, then we go to the right eye, okay? So it's pretty self-explanatory, but basically as you put the values in, your choices are going to be normal, abnormal, okay? And what it'll do for you is it'll automatically calculate out a number, and it will put that number right here. So right now the value starts out at 100%, but as you get people who are not able to distinguish in the pink band or below for the left or right eye, column C, column D, it'll actually give you a percentile score, which I find to be very, very helpful and a whole lot easier to describe to the patients. And if the score is less than 100%, this normal right here should flip to abnormal. Mark-ons. Again, here's all the patient information, their demographics and whatnot. This one you'll leave blank because it's going to be a repository for future information. You'll put in the result, whether it's positive or negative. Okay. Just so you see what it looks like. A positive is going to be red, a negative is going to be green. Okay. Then you can put in your sensitive, intermediate, resistant, and you can do this one of two ways. You can either hit the drop down arrow and select which one it is, or you can just simply put in RSI. It's a lot faster to do it that way as you run down the list. Down below here, I've got a bunch of different treatment modalities that I've put together. And you can either paste these into your medical record prescription format, or the other thing that I have done, and the reason I've done things this way, is you can very easily grab the patient's demographic information and either hit Control-C or come over here. And if you'll notice, these are some of my prescribing templates that I use. Okay, so for instance, if somebody has a Marcon's issue and they need to be treated, you pull this up and you would make a copy of this, and I would copy it to the patient's folder, and again I would name it with today's date, last name, first name, then Marcon's RX. Okay, so instance of this particular person, I would put in 2019-1109 test patient, or patient test as the case may be, and I would save this in the correct folder. I'm not going to go through all this right now, but what you can do then is just put the date in, drop down line, and you can either paste it linked or unlinked. And I do that just to make it a little bit easier. And then what I do down here where it says RX, I'll come back to whatever form of treatment I'm going to be giving this person. I'll put a little X here so I know what's going on, and I will put the date prescribed. And basically all you have to do is just copy this information, Control-C, oops, wrong one, go back over here, and paste and edit. So you just decide how much you're going to give the patient. 30 cc's is usually enough, but if you want to give them extra, you can put 60. come over here, you can see how you get the place to adjust the column, and you'll put in, say, 3 times a day, 2 sprays per nostril, and to make this a little bit better vertically. And there you have it. There's your prescription. And I've got a few different pharmacies here that you can use, or you can use the compounding pharmacy of your choice. And once I've done this, what I'll do next is I will download a copy of it as a PDF right to the patient's folder. And then by doing that, it's there permanently. I know what was done for the patient. It just takes a few moments, and it's a pretty quick, efficient way of getting your prescriptions done for your patient. So that's just one of the things that I've utilized over the years that I've been doing this to just make it easier. Let's see, we'll delete table, and there we have it. We're good to go. But I've got these little things put together for my Marcon's prescriptions, for my LDN, oxytocin. I've also got a nice little NeuroQuant one done where it's got the CPT codes, ICD-10 codes, all the information you need. It tells the imaging center very specifically you don't want just an MRI of the brain without contrast, but it's got to be done with a Cortec Labs affiliated NeuroQuant, and it's got to involve the morphometry and the triage brain atrophy. So it's very, very simple, very, very quick and easy, and all the information you need is right there on it. All you have to do is just basically put the date in, and no, it's the wrong one, but you get the idea. You'd put the patient demographic information in from right up here. That's just a very quick, easy way to do all this stuff. Okay, all I did was I created a sheet within the Google Docs. I put my logo on the top, on the footer. I put the other parts of the things that I wanted, and it was very simple. I also chose to put in some of my personal information here as far as NPI numbers and so on and so forth. So this way, everything that is necessary has been done. It's just a very fast way to put together the information that the patient needs. So it's just a little something I'll throw out you as a time-saving hint that I've come across. Next, we'll go to the ERMI and HERTSMI. And again, the leftmost column is where you want to keep your information. You can select up here, go to Tools, Macro, and ERMI HERTSMI. Some of these macros don't work real well where they come across, they just, they create the space, but they don't put the information in. If that's the case, all you have to do is come over here and highlight the range that you want. Hit Control C or copy, and then select the range of where it's all going to go. And there it is. And then what you'll do is you'll put in the raw information here. And the way I've set things up, if somebody gets an ERMI score, as you enter the information in here, it should also populate and calculate not only what their ERMI score is, but also it'll calculate out what their HERTSMI score is. And that value will pop up right here. Okay, and it'll be color coded as well as far as their risk levels are concerned. If you look down here, you'll see that I've got a lot of the different fungi that are reported on and what happens with these fungi. And of course, these are hyperlinks, so you can go and get more information than that as well if you want it. So there's a lot of information here. I think it'll be very useful to people who get in the habit of using these spreadsheets. For our next trick, I've got similar situations going. This is the mycotox from Great Plains Lab. Okay, and again, you keep the rightmost column available to hold on to the formulas and whatnot. You can just come down here and either click the macro to run, or you can do it manually yourself. We'll just delete this column for a moment. And the way you would do this is you would just select the column, hit copy, insert column to the left. Let's see here, why is it not doing that? There we go. And select the column and paste. So there's the information again. I just want to emphasize that the most recent data will always be the farthest to the left, the eldest data will be the farthest to the right, and the farthest most to the right should be an empty column where you've got all your formulas. GI map, got all the information there. I'm going to bypass PFTs for just a minute. No transmitter, similar situation. I have an interest personally as well for the stress echoes and the VO2 max. Okay. I personally have pulmonary hypertension, and I think that there's a lot of people out there that we treat and that we don't really fully take care of all of their issues. Uh, Sometimes the shortness of breath is due to asthma, emphysema, some kind of lung problems. It can certainly be cardiac in nature as well. So I've put together information for a stress echo, and again, I've got all the different formula involved here. Uh, VO2 max testing really is not being done as much as I think it should be. I've had patients who have tested that are certainly impaired and have values that put them into the disability status. Again, you'll see that there are certain areas where we've got the little black triangles with more information. But as you enter the information into these, I think, anybody that chooses to do this, I encourage it. I'm trying to collect as much data as we can for this disease. The Rosetta Stone that Dr. Shoemaker talked about, this is the interpretation. And as you put the values into LabCorp, a lot of these things will automatically populate over to the Rosetta Stone, which of course is back here. And what I do is I just throw the LabCorp range in here as I go through and calculate it out. Then I figure out what's going on as far as what their scores mean. And I'll copy this. You'll see it's got the little dotted lines around it. Come back over here to LabCorp, copy this, and just paste it in place. And then depending on what's going on with the patient, I will mark, for instance, this area. I'll just simply embolden it. Okay. And this just tells me at a glance what's going on. I will also color code these two ranges with the same color of whatever is going on here. So these are just some simple things that I've come up with along the way that I find to be very, very helpful. I'm going to put in a quick plug here for another device. We do spirometry in the office, and for an investment of less than $1,000, you can get a handheld. I use a WinSpiro 2, a SpiroBank. SpiroBank 2 is the name of the device, and basically it generates a whole lot of information. It doesn't take very long to do it. And what ends up happening is you get information that looks like this. You can have the data exported to an Excel format for Microsoft. And what you'll find is if you simply hit Control A and then Control C for copy, again, you got the dotted lines going on. You come over here to Temp Data, click on column cell 1A or A1, Control V, and it pops all the information in just very, very quickly and easily. And now watch what happens if we come down here to macros. Oops. And we go down to transpose PFT data. And the magic happens. What would ordinarily be quite a time-consuming process, you can see it's automatically throwing a lot of information together, finish the script. I then come over here and I select columns F, and I hold the Shift key down when I select this. That way we've got this whole range. And then when you select a whole bunch of cells like this, I've done to the left, if you just change the one, you change the whole row of them. Okay. There's a little flaw I can't figure out. Right here, you get a 0, but if you just simply come up here above, select this, drag down 1, that's where your value's put in. And you've got a lung function of 87%. You have oxygenation. You have lung age. All this information just automatically populates. Anything that's a little abnormal shows up as slightly yellow or orange. And then if it was markedly abnormal, it would be red. In this column right here, I do 3 sets of each run. I do forced vital capacity, maximum ventilatory volume. And then what I'll do is I'll have the patient do a 6-minute walk test exercise. Then post-exercise, we do 3 values. And then we give a bronchodilator, wait a little bit, and repeat the testing. The purpose for doing 3 is it gives us an idea of how reliable the effort is. Okay, so if everything is reliable, you'll get nice green markings to this effect. And as you scroll down, you'll see there's just a huge amount of information. Everything you could want to know about the patient's lung values. You have to manually enter their O2 sat and their heart rate each time you run the test. But it gives you a lot of information about how badly the patient's breathing status is or is not doing. And it gives a better handle, too, on whether or not does this patient possibly have asthma, emphysema, pulmonary hypertension. Could there be a mitochondrial problem? If it's a mitochondrial problem, you have to do the VO2 max testing. So all this information right in here is present. And this template, this macro that we just ran, also created a new set of value ranges that you can put in the next time you have to do this test, okay, with all the usual information. So, and of course, over here you've got all the patient demographic info and whatnot. I'm not sure why this didn't populate, but we won't worry about it right now. And then the PFT temp data, you just simply delete everything for the next run. Okay, so for the next, we have the neurotransmitter profiles, and this has to do with just some basic information. I've selected some different labs. They're either hyperlinked, so you can get an idea of where they're coming from. But we find that some folks have neurotransmitter abnormalities, and you can address the amino acid profiles. Amino acids are the precursors to the neurotransmitters, and that's a nice way you can affect some mood disorders too, because as we all know, the inflamed brain does not work well. You see a lot of neuropsychiatric syndromes associated with brain inflammation. There's also patient financial resources I've put together to keep an eye on the economics of things for people who don't have a very robust practice management software. There's also information on doing impairment ratings on your patients for those that may be impaired. And there's a lot of information here as well. Here's the AMA guides to impairment. It's really not that big a deal to look at this. I've saved what I hope to be the best for last. This is the NeuroQuant morphometry. And basically, you put in the study date, intracranial volume. It should be putting all the information in up here as far as the demographics are concerned. You have to manually enter all this information. So this will be the morphometry page. And again, I'd like to remember, keep the farthest area over here to the right to use the formulas in the future. But I start off with entering the information in column H here. And then the next time I do the test, I would, grab this information, copy it. And it's very simple to create new columns to the right. You'll also notice down here, a lot of these things will have further information below where the data is entered. So instead of selecting columns, if you come over here to Tools, Macro, neuroquant morphometry, new column. It's obviously more than a column, but you'll see that it's created the space. It just didn't create the actual information you need. So you'll have to manually come over here and grab this, Control C for copy, and just paste all the information in. So you're good to go. Um, let's go over to the triage brain atrophy report. What I've done with this, you'll notice first off all the data information. Everything is in hyperlinks. There's a lot of information here, and you can get even more just by clicking on the hyperlinks. As you enter the data manually, unfortunately, what will happen is if it's within the Goldilocks zone, plus or minus 1 standard deviation, the data will come in as green. If it's -2 to -3 standard deviations, I'm sorry, -1 to -2, or +1 to +2 standard deviations, it'll be yellow. And if it's 2 to 3 standard deviations on large, it'll be blue. On small, it'll be red. But it'll pop all these colors in here as you're running down the list. And it's very easy to get a quick eyeful of what's going on, and you'll have an idea of where the patient is at in different areas. You don't have to worry too much about the green zones. The yellow zones might be a problem, and if it's anything in blue or red, you definitely have a problem. And you need to know, okay, what am I going to do with this information? What parts of the brain are being affected? How will it be presenting clinically? So that brings us to the final tab. And this one I'm very, very proud of. I don't know why it's acting up like this. I'll have to do some repair work here. But basically, what you see here is all the different areas of the brain. And it'll be in sorted by date as well, and there's the bell curve. But right here will be the gray matter. Okay, so we'll have to pop that down here where it belongs. We've got the ventricles and all these other areas. I think part of the problem is this is just too big. There we go. Anyway, you'll see that across row 11 here, actually row 10 is a better way to look at it. I've got the brain structure, the brain region, what happens in function and disease. The images actually belong over here, but the main neurotransmitters where possible, input from, output to, and I'll have these images fixed so that they will show up where they're supposed to. But basically this is what I've put together, so you can look at this all very quickly and concisely, and a lot of this information is set up again in hyperlinks, so everything that you want to learn more about, all the information is all automatically there. I just want to take a quick look and see on the template if it's screwed up on this as well. If it is, that'll give me an idea. Yes, it is. So we need to go through and rearrange a few things here, but I will take care of that, I promise. So in a nutshell, there's a lot of information here. It may seem daunting initially to look at it, but if you can take your time and maybe sign up with the Google Suite, copy these things over, the way it will work once you do so is, let's see if I can't, there we go. What happens is you'll get these forms. This will be the new patient ID form, for instance. And as you click over here to responses, you'll click on get email notification, which I highly recommend. Then you will select response destination. I've already put these spreadsheets together, so you'll want to just select existing spreadsheet. And this is the new patient ID form. Select. It's linking right now. And as we go to the spreadsheet, you'll see form responses 12. So what I would do in this case, every time somebody fills out this form, the new information will be coming here. So typically what I'll do is I'll just simply take this one, make it form responses 11, rename this one form responses, and this right here, you can simply hide the sheet. And now as the new information comes in, it will come to the form responses as the patients fill out the form, and you should get an email that it's been filled out, and you just basically come over here, add one to the left, and as people fill out this form, they'll get new information will appear here. You'll just simply copy, select over here, and transpose. And as we go to the next one would be the initial visit. And the initial visit is right here. You'll pull it up. And this is a rather large one, so it's going to take a few minutes. You come over here to responses. And when it comes to responses, by the way, also you'll be able to see each response. It gives it to you in all sorts of different presentations if you want to look at the form. But if you prefer to look at the spreadsheet, you can look there as well. But just to give you an idea, you can see from the tracker on the slider bar that this is one very, very long form. While this is populating too, let me just show you real quickly. It says here we're accepting responses, and we'll click on this to link it. And while it's waiting to get its act together, I just want to take a quick moment and come back to the new patient ID form. And if we go back to the questions and scroll down a little bit, I just want to point out, I've put in for our practice, here's all the HIPAA, omnibus, notice of privacy practices, all these things that the law says we have to do. And controlled substances contract, acupuncture detox, all this information. I don't have it in this particular copy, but I do have it in my own practice so that the patient can review all this information. So I've left this stuff blank for you to just basically paste in your information. And where you would do that is the following information is being provided where it says ABN. You can put as much information in here as you want for your advanced beneficiary notice. And as you can see from above, I've got a pretty significant amount of text here that just pops right in. Okay, so everywhere you see a little description, just put that information in place. Now let's go back to the other form, get email notification for responses. We click yes, and select response destination, select existing spreadsheet, and this is the SIRS initial visit responses. Select, and now it'll be linked. And if you go to the SIRS initial visit responses, just like before, this is response number 8. So what I would do here, if you double click, you can rename this 7. Click this one and call it form responses. And then you can just transpose everything over. And the way these are matched up, even though I've created extra space for things like these formulas and whatnot, all the information will go where it belongs. And we'll just come over here and I would hide this information right here, just to keep it easy. And anytime you want to look at your hidden sheets, you just come over here, click on all sheets, and you see all the information that you need to see. So that pretty much summarizes it. I got a little over an hour's worth of time. I apologize, it's kind of lengthy, but as you can see, it's quite involved. I'm also going to have a printed document that you can refer back to if you have any questions about how things are working. And you can certainly feel free to reach out to me. My information is on our homepage. The name of the practice is Appalachian Wellness, and the website is appwell.net. Feel free to reach out to me with an email. Um, and again, I've got my information right here as far as how to get a hold of me. But I hope you folks appreciate the effort that's been put into this. I've tried to set this up so that even people who are new to taking care of CIRS patients won't be quite so intimidated. There's a lot of resource information available everywhere. There's a little black triangle in the upper right-hand corner. You can click on that or hover over it. You'll get more information. And of course, I've also got links to resources that I found to be very helpful. So thank you for listening to me. I hope I didn't put you to sleep. And I even more hope that you will take advantage of this gift that I'm offering to everybody so that we can start utilizing this and getting some good data collection going. Thank you.